heard at the Johnson Depression Center. I know that this is where I'm supposed to be for my care. I am diagnosed as having bipolar 1. I have both hypomanic and depressive spells. Things have gotten better since I've been part of the Johnson Depression Center family of people.
The Helen and Arthur E. Johnson Depression Center provides state-of-the-art clinical care, community programs, as well as training and education for the next generation of clinicians.
The Helen and Arthur E. Johnson Depression Center has been around since 2008. We see about 1,100 individual patients a year and about 15,000 visits per year, centered on the treatment of mood disorders.
The 4 mission pillars of the Johnson Depression Center are clinical care, community education, workforce development, and research.
Clinical care is really built around the idea of a team-based approach to treating patients. So many patients that we treat see both a medication prescriber as well as a therapist. We have team meetings every week to talk about new issues that may come up broadly in the field of psychiatry, but also we look at individual patients to try to put our communal brain power together to figure out solutions for those patients.
One of the real benefits for me personally working with this group is the ability to connect with folks at the Depression Center who have such a deep expertise in a lot of different areas that are clinically meaningful to our patients.
I feel like everyone is talking to everyone, of course with my permission, and I think that having that fully integrated care really helps up the ante in terms of the type of service and care that I get as a patient.
I am very proud of how we're really reaching out into the community, into the workplace, into schools, to help people address mental health concerns before they become a crisis.
We can help them with strategies to talk to other people, to think about things a little bit differently without having to necessarily come directly into the healthcare system.
There's a lot of different ways that the JDC has been investing in community education. The project that I'm most directly involved with is the COBE project.
COBE stands for the Colorado Bipolar Education Project, and it is a program that we started in 2022 based on really a need to educate providers about bipolar disorder and also educate patients and families.
I did participate in the multi-week seminar series that they had last year. And interestingly, my husband participated in that alongside of me, and my mom, who lives in Ohio, was a conversation starter for us. It led into conversations that my husband and I had, things like, yeah, we've experienced that, or, oh, it's really interesting to know how this connects with you or how this is pertinent in our lives.
Education about the illness is at the center of every successful type of therapy for the disease.
We do research that helps us to discover new reasons why people might be experiencing depression and anxiety and bipolar disorder, but also we're doing research that helps to promote better care for individuals suffering from these illnesses.
We've had several NIMH grants looking at different psychotherapy interventions for bipolar disorder. Our most recent work has centered on adolescents and children who are at risk for the disease, and we have staged an early intervention to using psychotherapy to try to change the trajectory of the illness.
Again, the depth of the expertise within this clinical team presents some opportunities to work in some really cutting-edge, meaningful research so that you can be involved in a lot of the development that's contributing to the field in a larger sense.
They're also a place where I've been able to come and say, look, I was reading about this. Can you tell me more about it? And they've always been able to tell me more about it. They always know what's going on. I feel like I'm in the hands of people who care enough to be on the cutting edge of all of this.
What is so important about the way the Johnson Depression Center has really cultivated training the next generation is the way that they're investing in us. They're celebrating diversity of discipline, really training their workforce and training us in how to work on interdisciplinary teams. I actually started my journey at the Johnson Depression Center my last year of graduate school. I was lucky enough to get an internship placement here. My final year of school, I interned at the Johnson Depression Center, and then postgraduate, I did a 2-year fellowship. Upon completion of my fellowship, I was fortunate enough to be hired back at the JDC to come home to them. I am the clinical director of a new intensive outpatient program that we're getting started here at the Depression Center. I knew that, if I can grow this much in 2 years, like, where am I going to be in 5?
I know that life is only going to get better and better for me as a result of the Johnson Depression Center. I'm receiving the care that I need that works for me.
But at the end of the day, it's really about empowering people to move in the direction that they want to. And I think that that's something that the network of providers, the organizational structure of the Johnson Depression Center really supports in a number of ways.
It makes me emotional when I think about how grateful I am for the Johnson Depression Center, because I know that I would be in a different place if I didn't have people like the caregivers that I have that are all in one place, easy for me to access and always there for me.